Hey everybody, it's Evan here. It is March 28th, 2013, and this is about like the third attempt at a video I've made in like the past couple weeks. For some reason, every time after I make a video, I just decide that I don't like it, and I decide not to post it, and then the time comes where it's just like kind of too late to post it, and you know, seeing as it's almost April, and I'm nearing more my 8th month post-op mark, I figured I would make a video as kind of like an in-between, more so 8th month post-op video, just because I'm probably going to get really busy soon. I'm on spring break right now, so I have time to make a video, and but I start my next quarter for school really soon, so I decided, you know, I should probably get a video out before then, before I get busy and actually have a real excuse why I'm not making a video. So on April 9th, I will be 8 months? I think that's right. I'm pretty sure I'll be 8 months post-op. I had my surgery with Dr. Brownstein in San Francisco on August 9th, 2012. I guess I might as well just get right to it. Yeah, this is my chest, almost 8 months post-op. I don't know if you can see, but, I mean, things aren't really changing very rapidly. Something I have noticed that's happened in like the past couple months or so is the scars are getting a lot like lighter and flatter, especially on my left side. I'm losing like a lot of like the red color that's there, and it's starting to get a little bit more like skin color, which is awesome. Yeah, I think they're doing pretty well. There's not much else to say other than that. Nothing's really changed that much. I'm nearing my 3-year on T mark in July. I'm sorry, I'm playing with my hair a lot, but I really need a haircut. I know this, I really need a haircut. I'm just lazy, and I was gonna see if I could deal with growing it out, but I think I'm kind of fed up with it, and I'm about ready for my short hair back. I'm gonna move on to the topic I wanted to cover in this video, which I think it's an important topic to cover because not many people talk about it. At least I haven't seen many people talk about it. It's post-op depression and anxiety. I know I should have probably talked about this back when I was like directly post-op, because that's when most depression occurs. Most people don't realize that it's normal to experience post-op depression, and it's very common actually. A lot of people who are going into top surgery, and you know it's your first surgery that you've had, you should probably be as prepared as you can for that you're going to be feeling some depression after the surgery. Basically, you know, this huge change is happening on your body, and no matter how excited you are for it, and no matter how prepared you think you are for it, oftentimes your body is just going to react in the way that it reacts. It's going to, you know, while it's recovering, you're going to kind of feel crappy, and I personally went through this, so I think it's an important thing to talk about, and I've heard a lot of other guys who've gone through it, and at the time, you know, when you're going through it, at least when I was going through it, I was like, what the fuck is wrong with me kind of deal, you know? I was like, I should be really excited about this, and, you know, I was really excited about my surgery, and I was really happy to have it, but I was still feeling this, like, depression. The big thing about post-op depression, post-top surgery depression, you gotta know that it's natural. You know, you're not some freak, this isn't, you know, this isn't some, like, weird regret you're experiencing, and it's going to pass, you know. The thing that I did to cope with it was I went and talked to a therapist. I was not only having depression, but I was also getting major anxiety, which was weird because I never really gotten anxiety in reaction to anything. Like, I mean, I had anxiety, but I didn't have, like, anxiety attacks until after surgery. And the thing that helped me most to get through anxiety and the depression was to talk to someone, to talk to a therapist. And I know a lot of people can't afford that, but maybe just a close friend, just to talk to someone was basically how it helped me. And also just to know and be aware that, you know, my body is going through this, my body is feeling this way, not because, you know, I'm disappointed about my surgery. I was really, really happy about my surgery. It was, you know, my body's reaction to just being cut open, you know? It's kind of getting back to that equilibrium, that natural state. And you know, especially if you're like traveling and things like that for surgery, you're gonna be kind of like, your nerves are gonna be everywhere, and you're gonna be, you know, not only excited, but hella nervous. So, you know, you gotta realize that your body's just kind of reacting, you know, to all the new and craziness that's going on around you. So yeah, not only did like talking to a therapist help, but my therapist taught me some kind of ways to cope with the anxiety and stuff that I was having. And I mentioned this on my blog, but I think it's important to mention in the video in case a lot of you don't have Tumblr and things like that, and it was an old post. So I kind of just want to mention it really quick in this video. I had a lot of T-shot anxiety. It continued for probably at least a month to 2 months after my surgery, where I would have to have other people do my shot for me after 2 years of doing my own shot. I mean, there's a lot of things you can do for T-shot anxiety. Like, if you're doing intramuscular shots, you could switch to doing subcutaneous, which have smaller needles, or you could just see if you can use a smaller size needle for the injection for intramuscular. Although I'd been able to do my shot for 2 years before that, so it was kind of weirding me out why I couldn't, you know, I suddenly, after surgery, couldn't do my shot. And I didn't think it was, you know, anything. I wasn't afraid of needles. It wasn't, you know, I wasn't afraid of the needle. I wasn't afraid of the shot, really. I just physically would work myself up and get so anxious out of nowhere that, you know, I just wouldn't be able to do the shot. After I practiced, you know, some of these techniques, I was able to do my shot again, no problem. And it also helped with a lot of the depression I had after surgery was, I really started meditating again, which I kind of let slack for a little while, but I started meditating again, just to improve, like, my kind of, like, stability and equilibrium. I know that sounds kind of silly probably to some people, but meditating actually does help, at least for me. A lot of people it doesn't help, but for me it personally helps me kind of align myself better. And then on top of the meditation was just kind of being self-aware and just not judging myself. And by self-aware, I mean just noticing when feelings of anxiety came up in me, where they were kind of centered in my body, like where I would get tense when my feelings of anxiety would come up, and just kind of noticing that and not judging it, not saying like, oh, that's stupid, or oh, you know, I shouldn't be feeling that way, this is like, I'm such a wimp kind of thing, not judging myself, but just noticing that, you know, I'm getting anxious, you know, trying to notice, you know, why is this happening, you know, what am I reacting to, and but no judgment is a really important part of it. So yeah, and just remembering to breathe, that's always a good thing, and just to be positive about things, just in general, every day. Not even when I was about to do the shot. It was more about just being positive in a general manner, you know, and that helped a lot with my depression. It was just kind of realizing, I know it sounds silly, but realizing the little things. You know, it was this depression that kind of resulted from surgery, and from, you know, going through all this kind of really mentally taxing events. And so when I found that I could, you know, focus on little positive things, it actually really helped. Just to kind of, you know, get myself away from that kind of cyclical depression kind of thinking. And not overthinking. Overthinking is probably the worst thing that I do ever. Not overthinking was a huge thing that I still have to get over when doing my shot. Just kind of going and doing it, because I've done it a bajillion times, and, you know, it's not something that I should be overthinking. You know, it's something that I should be thinking about, but it's not something that I have to overthink. But that's basically all I wanted to say. If I wasn't clear about anything, or if anyone wants to talk about anything that I mentioned or needs any advice, please feel free to comment or message me on Tumblr. Alright, well, I hope everyone has had a good March so far, and I hope I'll make a video soon enough. I'll see you guys soon, and hopefully I'll have a haircut by then. See y'all later. Thanks for watching.